Let me start by making one really important announcement for anybody here at Columbia and then later on for anybody in the broader community. So we put together a large resource of molecular profiles that have been generated with the help of the CUB, the Columbia the University Biobank, which include both RNA sequencing and exome profile from patients with COVID-19 and negative controls. Just to give you a sense, there's about 1,088 exomes for COVID-19 positive patients, as PCR confirmed. 392 RNA-seq profiles from nasopharyngeal swabs with COVID-19 positive and negative patients, again, as validated by PCR. However, because the RNA-seq is in some way even more sensitive than the PCR, then there is a further subdivision of true positive and true negative that changes those numbers a little bit. But generally about 260 positive and about 130 negative samples. And these are really associated with clinical correlative data, including outcomes, hospitalization length, et cetera, gender, ethnicity, and so forth. And a number of other clinical parameters that are from EPIC. Just wanted to go briefly over kind of the data access rules. So there's really 4 requirements. The first one is that people should submit an actual proposal to the CUB Sample Data Access Committee that describes the study that they want to do and why they need the data. They should have an IRB approved protocol for the proposed study, and they have to file a track request for access to clinical correlative data. I'm not sure that the track request is required if all you need is the gene expression data, but there's not much you can do with that because obviously there's so much stratification that is necessary to isolate other confounding factors that most useful use of that data will be through also leveraging the correlative clinical data. And then there's a sort of like for TCGA, there's an agreement to withhold submission of manuscripts on topic conflicting with the 5 primary studies that were key in generating this data until either the publication of 6 months from Access, whichever comes first. So it's a relatively short period of, and most of the time I think this will be necessary for anybody to get their research done anyway. But we are trying to be cognizant that some people spent a lot of money and time and effort in trying to put these data sets together. And so the people that will want to use it should be respectful of those 5 manuscripts. So these are the specific instruction for filing the application with the CUB committee, and also instruction for linking the IRB or submitting a track request that can be found on the website. And hopefully maybe either Jesse or Esther can actually forward this information and this presentation to the broader team. And these are the 5 studies that are currently underway under which these data were generated. There's a study on TEMPROS-2 based on single nucleotide polymorphism by David Goldstein. One on basically predicting and experimentally validating drugs that may affect the host impact of the virus, where myself and Wellington Cardoso and Sagi Shapira are co-investigators. Dr. Ullman for the exploration of microbiological determinants of COVID-19 severity. A study by Christoph Kirluk on basically a GWAS of the genetic risk variants emerging from COVID-19 exome data. And finally, the exploration of host immune response and molecular evolution of SARS-CoV-2 to identify biomarkers of disease severity, Sagi Shapira and myself. So just to let you know that for any additional questions, you can contact Danielle Pendrick. This is her email, and anything that maybe you might want to ask. But this is a really terrific resource that that was put together in very limited amount of time, and is now available to anybody internally at Columbia. And we hope that as soon as these manuscripts are posted on bioRxiv, we will make it available to the broader community.